Welcome to the Master Cares YouTube channel, where we share with you how the Master Cares ministry is saving lives of children through its medical facility, the Master Cares Community Hospital. In this particular video, we show you how Dr. Isiko is saving the life of a child through the incubator at the facility. Whilst this story is heartbreaking, enjoy seeing what this ministry does.
So this is a neonate. When examining a neonate, we examine from head to toe. We first look. So you look out for any abnormalities starting from the head, the fontanelles, the ears, the nose, the eyes, inside the mouth. We call these the upper limbs, the chest, the abdomen, most importantly the back, for any spinal bifida and any other abnormality. Then our lower limbs, there is any abnormality. And then lastly, our genitalia. So on examination of this baby, there is no physical abnormalities seen, but we can see signs of prematurity in this baby. He has what we call lanugo hair at the back. It is more prominent at the back. Then the ears are flat and they are retracted. If you have to look at the genitalia, it's not well formed for a term baby. So our baby is both preterm, malnourished, and has a low birth weight, which are all predisposing factors to malnutrition. Then there are systemic. We start with the CNS. First assess if our baby can suckle. You place a finger in the mouth. So either the baby doesn't suckle, has a weak suckling reflex, or fully suckles strongly. So we examine other reflexes. We have reflexes we examine in a neonate. We have the grasp. So this baby has a weak grasp reflex. So you put a finger, then you try to carry the baby and tries to pull on your finger. So that's a grasp reflex. We have the moral. I may not examine the moral from here. We have a routine. So you find that our baby, still on the central nervous system, we examine the fontanelles. Is it triangular for the anterior one? Is it triangular? Is it not depressed? Is it bulging? You examine the posterior one. So our child has a normal posterior fontanelle, a weak suckling reflex, it's a weak grasp, but he has a complete moral. So we go ahead to examine the chest for the respiratory and cardiovascular, the breathing and the heart. So we first check for any deformities of the chest. Our child has no deformities. We touch and feel for the heartbeat. Where it's located. We also count the respiratory rate for our child. If our child is not breathing well, we have to get the respiratory rate because it will tell us of a possible diagnosis that we shall have to treat the child for. We go ahead and listen, use a stethoscope, listen to our chest. So as this child is crying and tries to pull the air, you can as well listen to the breath sounds and find out any abnormalities within the chest and treat accordingly. The next system to examine is the abdomen. So the abdomen goes with the genitalia. So still we first look and see if there is any abnormality seen within the abdomen. We try and touch for any masses. So as we are palpating or touching, we are looking for any masses, for any enlarged organs. We very well know that we have our liver inside our abdomen and our spleen. So we shall find out, are these ones enlarged? They also point to a certain diagnosis. Then we also listen to our abdomen we normally listen for the bowel sounds. So our child has present bowel sounds and they are all normal. So you'll find that children who don't have bowel sounds that are present are normally having obstruction within the bowels, and they might need urgent surgery to relieve the obstruction. Lastly, we check for the genitalia. Is it normal? Is it well developed? Is it premature?
You can choose to partner with the Master Cares Ministry in saving the lives of the children by being a monthly donor or a one-time donor to its medical program where the lives of the children are saved.